It's been another grim day in Britain's COVID pandemic. In terms of new cases, we have hit another unwelcome record with 62,322 people testing positive in the last 24 hours. What's more, and just as worrying, for the first time since last April, we've also seen the daily death toll exceed 1,000. Now, because the lockdown was implemented so late by Boris Johnson, we can expect that figure to only go higher. On the brighter side, unlike in the first wave, a vaccine does offer a way out. However, with Chris Whitty, the chief medical officer, warning yesterday that we will still have restrictions next winter, might the COVID outbreak be around for a longer period than any of us had hoped or expected? More immediately, as the last 9 days of the 50,000 plus daily COVID cases will not yet have translated into hospital admissions, can the NHS cope? I'll be speaking in a moment to Tariq Jenner, an A&E doctor in a London hospital, to speak about the reality on the NHS front line. And as usual, on a Wednesday, I'll be joined throughout by my esteemed colleague, Aaron Bastani. How are you doing, Aaron?
I'm very well, Michael. How are you?
I'm all right, considering. It is looking hella grim, though. We're also going to have two items of non-COVID news. So first, we'll speak to Jacobin Editor Bhaskar Sunkara about the Democrats' victory in Georgia. And we're going to end the show with the news of the latest billionaire-backed news outlet, which intends to drag Britain's media establishment further to the right. Yes, that is possible. As ever, you know the score. Share the show, stream. Tonight, this is a bit of news for you. We'll also be streaming the show on Twitch. So you're welcome to join us there. If you have a Twitch account, make sure you follow the Novara Media account on there. We'll probably be doing some Twitch-only content fairly soon. You can follow our Twitch channel at twitch.tv/Novara Media. Now, today we expect legislation for a new national lockdown, the one announced on Monday, to breeze through Parliament very easily, with the rates of transmission and hospitalizations meaning even the most deranged headbangers on the Tory benches have fallen into line. I think there's still a couple of holdouts, Desmond Swayne among them, but Boris Johnson doesn't have to worry about getting this piece of legislation passed. There was, however, one bit of the bill which has raised eyebrows. That's the end date. So briefings on Monday suggested the current lockdown would be in place till around mid-February, yet the bill legislates for restrictions until the end of March. Today in the Commons, Johnson explained why.
And as was the case last spring, our emergence from the lockdown cocoon will not be a big bang, Mr. Speaker, but a gradual unwrapping. That is why the legislation this House will vote on later today runs until the 31st of March, not because we expect the full national lockdown to continue until then, but to allow a steady, controlled and evidence-led move down through the tiers on a regional basis, carefully, brick by brick, as it were, breaking free of our confinement, but without risking the hard-won gains that our protections have given us.
So Boris Johnson there raising hopes that even though there will be restrictions in place until the end of March, they might not be as extreme as they currently are now. So suggestions that at least some parts of the country will be moving to lower tiers before the end of March. Now, the length of time we will be able to, we will have to endure, I suppose, until the restrictions are removed, has been front and center of many people's minds today because of something that Chris Whitty said in yesterday's Daily Downing Street briefing. Now, we're going to show you quite a large chunk of his answer here because I think this is probably the best exposition we've heard so far of what the government strategy actually is going forward.
What is going to happen over time is the risk level is gradually going to decrease. It's not going to be, it's really bad and then suddenly it stops. We're going to essentially have the risk walking down a path. Things will be able to be lifted by degrees, possibly at different rates in different parts of the country. We'll have to see. And the government has made very clear that ministers prioritise education, for example, as one of the things that would go early, but that's a ministerial decision very much. But the things we lifted stage by stage. And we'll then get, over time, to a point where people say this level of risk is one that society is prepared to tolerate and lift, right down to almost no restrictions at all. We might have to bring a few in in the next winter, for example. That is possible because winter will benefit the virus. But the aim of this is to de-risk it as much as possible by the vaccine to the point where actually we get to the stage where the risk is incredibly low relative to where we are now. I mean, we just say, just as we do with flu, where every year, roughly on an average year, about 7,000 people a year die. In a bad year, up to 20,000 people a year die. We accept there is a level of risk that society will tolerate, and we should tolerate. People die. That's one of the things that happens. And we have to do that at a certain point. But that's a political decision. That's a societal decision. What we can do, though, with the vaccine is take the risk down and down, initially with the mortality, then the big pressure on the NHS, then the risk of people actually having infections which could lead to things like long COVID, because younger people can still have really serious problems with this. And those risks, little by little, will be reduced by vaccination. But zero risk is not something which is a realistic possibility, and this will not happen in a single bound. It'll happen by degrees.
I want to bring you in, Aaron. Lots of people, I think, were fairly disappointed to hear there that we might have restrictions even next winter. I think most people were expecting us to get back to normal at least by summer. Were you surprised by that comment? And have you got any idea in your mind about what those restrictions might look like?
You know, I thought it was remarkably candid. I didn't expect that degree of honesty, because that is frankly what is going to be the case. We're also probably going to have restrictions, you know, the winter after that, and the winter after that, and the winter after that. It depends how you want to define restrictions. I think we're clearly going to see a long-term change in social behavior. Some of that will be imposed, some of it will be voluntary, some of it will be coercive, some won't. So, for instance, more people will probably choose to wear masks on trains. More businesses will ask you to, clean your hands with a disinfectant before you enter the building. More workplaces will talk about these things in a very soft, kind of nudging way. In terms of the actual hard restrictions, I mean, you can see how if there was an outbreak next winter, and of course we will have the vaccine, but if for whatever reason there was a region of England where all of a sudden you had a large number of cases in any case, I think you would probably expect to see something of a regional lockdown or regional extension of test and trace, and certain measures being taken, certain prohibitions. I think that's a realistic scenario in terms of where we are. So I was surprised, but also, you know, perhaps finally we're getting a degree of honesty now that is only really possible once you have a vaccine. Because, of course, when you don't have a vaccine, talking about these things can be quite frightening. And being honest with people who are having to make huge sacrifices is very difficult. When you've got the Hail Mary of a vaccine, and it is that effectively, that's a bit more possible. So hopefully we can hear, you know, a more honest assessment of the next 6 months, year, 2 years, if not from the Prime Minister and from politicians, from the Chief Medical Officer and so on.
Yeah, I mean, I actually thought what he said was in a way reassuring, because all you ever hear from Boris Johnson is him saying sunny uplands are around the corner. And what that makes me think is, wow, you've got no contingency plans in case anything goes wrong, which, I mean, has been proven time and time again. Whereas what Chris Whitty seems to be saying there is a bit more sensible, which is to say, you know, as we vaccinate more and more of the population, we will be able to loosen the lockdown, loosen restrictions, go back to something that looks more like normal. But as we know, this is a seasonal virus. We need to be prepared for the fact that we're not going to know exactly what's going to happen next winter. There isn't going to be 100% coverage. We know that these vaccines aren't 100% effective. We know that there might be new variants coming along. I mean, they seem quite confident that if a new variant does come along, which does evade the vaccine, they'll be able to, you know, engineer a new vaccine fairly quickly. But I think the idea that as soon as we've got, you know, 70% of the population vaccinated, we can just, you know, stop caring about all of this, which is, I think, probably what Boris Johnson and Rishi Sunak definitely want to do. I'm quite glad Chris Whitty is standing next to Boris Johnson saying, oh, whoa, hold up.
Also, it's important to remind ourselves this is the third distinct coronavirus this century. There will be others. And I'm not talking about strains of COVID-19 mutations, which I think BioNTech said that they could possibly engineer, you know, variations on the present vaccine to meet those mutations within 6 weeks, which is amazing, really, as a scientific feat of engineering. But there will be other coronaviruses. And I think as a society, between the fact that we're destroying so much of nature, biodiversity, and that allows greater zoonotic spillover, pathogens from other species into the sort of the human species. Between that and, of course, we just have a globalized world now, you know, incredibly interconnected trade, transport, free movement of people and goods. I think as a society, we're going to have to get very accustomed to more and more of these pathogens, entering our everyday lives. Flu and cold season for now will be flu, cold, and COVID-19 season, but there are going to be others too. And I think we need to understand that's now a permanent aspect of living in the 21st century.
We are a bit later in the show going to talk about more, decisions that the government has to make moving forward, whether or not to restrict incoming travel, which is a decision they clearly should have made 12 months ago, but also who to vaccinate first, and particularly or around the issue of teachers and education staff. Before that, we're going to talk about the NHS right now. But before that, if you're enjoying this show, do make sure you hit that subscribe button. We go live every Monday, Wednesday, and Friday at 7 p.m. And then also, often if there's a big news day which isn't already in our schedule. Now, everything we've discussed so far sort of involves speculation about the future, whether or not we'll still have restrictions next winter, whether the restrictions that we've got at the moment will be loosened by March. Before then, Britain faces a much more immediate crisis. That's because given the time lag between infections and hospitalization, no policy Britain adopts will have much effect on the damage COVID will cause in the next 3 weeks. As I've said already, today there were 62,322 cases reported in the UK. They aren't going to feed into the NHS for another 3 weeks. There are also 1,041 deaths recorded over the last 24 hours. Again, if you think about the daily cases we were seeing 3 weeks ago, that was sort of 30,000, 40,000. Now it's 60,000. So, it doesn't take someone with a PhD in maths to work out that probably in 3 weeks' time, that number is going to go higher, potentially significantly higher. We don't know. Now, all of this makes me think, if you told me back in spring that we were going to have more than 1,000 deaths every day again, I wouldn't have believed you. And that wouldn't have been for epidemiological reasons. I wouldn't have thought, surely this virus can't hit us twice. No, it was because of political reasons. I assumed that our political leaders would not be able to make exactly the same mistake twice after seeing what delaying a lockdown did and the damage it did back in March. How could they possibly do that again? That's what I'd thought. How naive I was. Now, the people who are, really, facing the consequences of this inaction by the government, of course, are the people who are tragically passing away and their family members, their family and friends. It's also people working for the NHS. They've been at the coalface during both waves and basically for the whole of the past 10 months. As I said, we're going to speak to an A&E doctor in one moment. First of all, doctors and nurses at London St George's Hospital have spoken to the BBC about working on the wards in the COVID second wave.
So I'm Jane Evans, I'm a consultant in acute medicine. There were many staff back in March who said I could never do this again. And then here we are facing what seems at the moment to be a worse surge of sort of patients with COVID. And you see people are very tired, very stressed. And that's a real worry to us because we just do have to keep going because we have to be here for the patients. But I do worry, about the scars that will leave some of our staff with.
They have to bite their lips when they're out and about these days. They're seeing people congregating in groups, they're seeing people at playgrounds, they're seeing people not wearing their masks, mixing, hearing of people having other people around to their houses. And they have to bite their lips because you may not see the effects of it when you're doing that, but we see the effects of it. The nursing staff see the effects of it. We have people in their 40s, their 30s, their 20s on our intensive care unit dying of COVID. We are having to think about whether we do cancer surgery. We're having to postpone cancer surgery because of the number of COVID patients we have in. So even if you don't think you are doing any harm by bending the rules a little, you are. It has a knock-on effect. And we are seeing the knock-on effect here.
That was the experience of NHS staff at St George's Hospital. To go into more detail about the pressures on the NHS and NHS workers, I'm delighted to be joined by A&E Dr. Tariq Jenner. Tariq, welcome to the show.
Hi.
And thank you so much for finding time in, I'm sure, what's an incredibly busy and stressful schedule to speak to us and
it's
our
my day off.
audience.
It's my day off, but it's fun. It's my day off. It's a nice thing to be doing.
Well, we appreciate it. And as you said, we spoke earlier and you said, actually, given that we're in quite an extreme lockdown, there isn't much else to do at the moment anyway, to relax. I wanted to start by sort of asking you from the perspective of a doctor in a busy hospital, how does the second wave of this pandemic compare to the first? What are the similarities? What are the differences?
So anecdotally, it's quite difficult for me to compare directly. During the first wave, I was working with COVID patients in intensive care at a different hospital to where I am now. And now I'm back in my parents' speciality, which is emergency medicine, so A&E. What we're seeing is very similar. There's, it doesn't feel, what we're seeing now feels almost worse than what we had at the peak of last year. It doesn't really show any signs of slowing, but without being, I guess, doom and gloom about it, there are some positives as well. Differences this time. We know a lot about the virus compared to the first time. We've got treatment plans and risk stratification based on data that we've gleaned from the first wave. So, and we know how to upscale our staff and open up areas that would have been kept for outpatients and elective procedures to be able to care for COVID patients. So that's the positive way of looking at it, but it's tough. Yeah.
No, I mean, statistically, we know in a way it's tougher this time around because there are more COVID patients in hospital. There are currently at least 40% more COVID patients in hospital than there were in the first wave. Something that I haven't yet sort of seen data on, but I've heard more sort of anecdotes about, and it's definitely caused, a lot of concern, is whether there's a different age profile among people who are attending hospital this time around. There've been a few interviews sort of on the BBC where a doctor has said this time around we're seeing much younger patients than we've seen before. And I know on one level this is going to be difficult for you to answer because you're on different types of wards. Last time you were treating people who were very close to death, and now you're the first person who greets them at the door of A&E. But what's your understanding of whether it's different people being affected this time to in that first wave?
So again, anecdotally, because I'm not, a breadth of the statistics on it, and I don't want to spread any misinformation or get things wrong from that side of things. There is a wide range of people affected by it. We know that the older you are, the more likely you are to become seriously unwell with COVID. We know that if you're from a BAME background, you're more likely to be affected by COVID in a serious way. And also if you have hypertension or diabetes and other risk factors. We're still seeing that now. I wouldn't necessarily say that I've seen excuse me, a larger degree of younger patients, but I have seen young people affected by COVID, ended up on ventilators, or even avoided hospital admission but felt the effects of COVID for months afterwards, and that's the really worrying thing about it. But age profile wise, not necessarily a huge difference from my point of view anyway.
And I mean, the big fear, and I think why we've gone into warning level 5, I can't remember precisely what they call it, the Joint Biosecurity Unit, is because they think that hospitals might at some point in the very, very near future have to ration care. And so I wanted to know whether you think that's likely, and I mean, what that would mean for you. Would you be, you're in A&E, can you imagine yourself, someone comes in, they're in their 80s, they're, critically suffering from COVID-19, and you have to subtly say, sorry, all the beds are full. I mean, how does this work for someone who's in that position on the front line?
Yeah, so I can understand why the public would be worried about that. We know that there are a limited number of beds. We know that we have limited numbers of staff and limited capacity for being able to care for people. But we don't turn people away at the door. Just like the first wave, we are here if you need urgent medical attention. And when someone comes through the door, they're initially, if they're either brought in by an ambulance or they walk in, they're seen by someone that will be able to riskify where or what sort of care they need. And we'll make decisions in conjunction with the patient and the relevant specialities about where they need to go. So, it's our job to look after these people in what are becoming more and more difficult conditions. But we don't really have another option other than to continue doing it. There's been no inkling of turning people away just because they're a little bit older or have added healthcare issues.
And one thing that potentially would have improved, and I suppose I would have expected to have improved since last time, is the risks that actual staff are being put under. So do you remember, well, I'm sure you remember because you were there, but in the first wave, it was a huge story that there was a lack of PPE and that doctors and nurses as a result were tragically dying. This time around, do staff themselves feel less personally at risk to they did back in March?
Yeah, I guess it feels more natural this time, putting on PPE and spending time in that stuff. It's like a second skin, I guess, almost. Different to the first time. when we were told that it was our fault that we didn't have enough PPE because we were misusing it, and felt a lot of anger at the incompetence of the government really in managing something so vital. Again, a positive this time is that I've not had a moment where I feel I don't have the protective equipment that I need available to me. So as much as they've not really learned very much from the first wave from a government point of view, in terms of our employers protecting us, I think they've done a great job this time around.
And my final question for you, I know from following you on Twitter that this is something that's really got under your skin, and I understand why.
Just a bit.
This time around, in this wave of the pandemic, we have an organized movement of COVID deniers or lockdown skeptics, people who are actually turning up to protest outside hospitals to sort of say this is all a lie, this is just like flu, it's all because of we're testing people too much. How does it make you feel to be working on the front line day in, day out, and then have people on social media saying, well, maybe COVID's not even a problem?
I mean, maybe it's a sign I should spend less time on Twitter. But honestly, we're really tired. We've done it once before, and dragging yourself and picking yourself up off the floor and doing it again is really hard. I think people forget that healthcare staff also like going to pubs and use seeing their family and friends and going out as a coping mechanism. We don't want a lockdown, but there's no real other option. So when you're working really, really hard and trying to encourage each other along, being told that everything you've experienced, everything you've done, every family member that you've spoken to because they're going through a really difficult time and feeling their grief, when you're told all of that's a lie by, yes, a small minority, but a very loud minority that are inexplicably given prime time slots on major news broadcasters in the view of balance, and can espouse their sort of really dangerous rhetoric to a large audience. It's tough. And seeing images of people protesting outside A&E hospital, A&E front doors, saying that COVID's a hoax and we're lying is insane. We can't even agree on a computer system that works for the whole of the NHS, let alone coordinate a hoax. I mean, we still use bleeps. We're not that organised. It's not possible. So it's frustrating, and it makes a really difficult job a lot more difficult. So please stop doing that.
Yeah. I doubt it's many of our audience who are replying to your tweet saying COVID isn't real, because that hasn't been our message. But Tariq Jenner, thank you so much for speaking to us this evening. And obviously, our thoughts are with you and our gratitude for the work you'll be doing over the coming weeks and months.
Lovely speaking to you. Thanks.
That was Tariq Jenner, an A&E doctor in a London hospital. We are now going to talk about a few more elements of government policy, which are, shocking that we're even talking about them now. So the first is that the UK has announced, or the British government have announced, that they're considering testing people on entry to the United Kingdom. Now, most people, when they hear this news, will say, what? Why were we not doing that already? Most other countries in the world have been doing this for quite a while. The countries who have been really successful at dealing with coronavirus haven't just been testing people when they arrive. They've basically been banning incoming travel. So the fact this is happening in January this year, when the virus was first transmitting, was first spreading across the world last January, almost beggars belief. I want to get a quote from the BBC article. So this is sort of the write-up of this particular story. Travellers to the UK from abroad could soon be required to prove they have had a negative coronavirus test. The Department for Transport said the measure is one of several being considered to prevent the spread of COVID-19 across the UK border. Additional measures, including testing before departure, will help keep the importation of new cases to an absolute minimum, the department added. Now, again, the response, no shit. Yeah, testing people when they're coming into the country, when you've got a pandemic, is a good idea. Aaron, I want to bring you in on this, because I know you've been writing over the weekend, actually, about countries which have sort of taken seriously the idea of not importing cases, especially Vietnam. Why has it taken 12 months for the British government to work out that, controlling incoming travel when you're in the midst of a pandemic is vital if you want to ever get beyond this crisis?
It's crazy, Michael. It's absolutely crazy. Vietnam, before COVID-19 even existed, before it was even known, before its genome had been sequenced, before people were exhibiting symptoms, Vietnam was better prepared for COVID then than Britain is today. What's today's date? January the 6th, 2021. Than it is today, after 75,000 people have died. And to illustrate that, there is an imposition, I think, of border controls with China by late January. There's an imposition of border controls. Basically, nobody from China can enter the country. I think 31st of January, February 1st. Same day, they closed schools across the country in Vietnam. Mid-March, you get the same measure being taken with countries from the Schengen area plus the United Kingdom. But even before the shutting of the border at the end of January from China, there were tests. So there were, for instance, they were checking temperatures. People had to certify that they weren't sick and so on. If they were found to be sick, they were legally responsible for effectively lying to the Vietnamese border authorities. So even before the end of January, Vietnam was doing this literally a year ago. And they then, like I say, suspend incomers from all kinds of places. I think basically by the end of March, it was March 22nd, they basically closed their borders. Now, we're so screwed in this country, that wouldn't really do very much. You know, we're basically seeing right now 50,000 plus nukes a day, 60,000 plus new cases a day. Shutting the borders won't do anything. Although I'm surprised more people aren't saying it because, of course, it's very welcome from the sort of right-wing perspective of UK politics. I'm surprised people like Farage haven't been louder and demanding it. But we clearly could have had tests at airports the minute this was an issue. We clearly could have had it when we had the first national lockdown in March. And I think, Michael, actually, to be honest, you and I, we're not epidemiologists, you know. We're not sort of civil servants in Thailand who are familiar with how, you know, SARS was overcome in 2003 and learned the lessons, which, by the way, it seems all of the Southeast Asian countries have done precisely that. But you and I said, well, surely we need to test people at airports, or at least shut people coming from certain countries. At the time, Italy was something of an epicenter. But no, people were freely coming to the country from northern Italy, which at that point was the epicenter of the virus in Europe, and they were coming into Heathrow and Gatwick and London City, no problem. And it was remarkable, and it had absolutely no rational explanation. The only sort of paradigm I can think of in sort of contemporary European politics is when Greece, Italy, when these southern European countries decided to join the Eurozone, even though it wasn't in their rational self-interest. I think this is an example of the Tories having a fetish for the free movement of the business class for business. Business necessarily requires porous borders for the elite, etc., that in no way can we slow down the circulation of goods and services. And they didn't think about it strategically. It was just, we can't do that. It's a bit like capital controls. They would never do it, even if it was in their rational self-interest. Forget the interest of the British state, in their rational self-interest, the interests of the ruling class, of the elite in this country. So it makes no sense. And it's something that has yet to be explained by the government. But again, it comes back to the point of opposition. When you haven't got an opposition demanding these things, it makes these shortcomings so much easier, because, you know, who else is going to ask this of them? Of course, by May, June, the first wave started to ebb. And so that was never really the big pressing question. We absolutely could have done it this time too. And it needs an answer. But sadly, I don't think we're going to hear that. We're not going to hear that in the House of Commons. We're not going to hear it from parliamentarians. I've heard Angela Rayner say it. It seems a very populist, common sense point to make, but I've not heard it from the Labour leader.
I mean, I do think that, the British government have been exceptionally slow on this. So most of our European peers have at least demanded a negative test before arrivals, or before arriving in their country months ago. But on the broader point, actually, this is an aspect of sort of response to COVID-19, which I think all of the Western countries, apart from Australia and New Zealand, have basically failed at. Now, you'll notice sort of when people compare the European responses to COVID-19, there are countries who are more or less incompetent than each other. So Germany, clearly much more competent than Britain when it comes to this issue. Ireland, for example, has been much more responsible, I think, in terms of the timing of the restrictions they've introduced compared to Britain. And for periods of time, that has really shown in the statistics. Britain had a much higher death toll than either Ireland or Germany. But I do think that the common thread, why all of the European countries have failed compared to most of the rest of the world, is probably because none of them took seriously travel restrictions. I do think that probably the Schengen area is one of the big reasons why Europe has failed on this. Obviously, the UK isn't part of Schengen, but we've had this borders can't close even in the middle of a pandemic, which the East Asian countries, I mean, that's the first thing they seem to do in a pandemic. If you're in a pandemic, it makes sense, close the borders to arrivals unless it's absolutely necessary, and if it is, make sure you do not just voluntary quarantine, because what we do in this country at the moment is we say, if you arrive, then we'd hope you to stay in your hotel room for a week or 10 days or whatever it is. Whereas in many countries, if you arrive, you have to pay for a hotel room for 10 to 14 days, and there's going to be someone making sure you don't leave that hotel room. And in a way, what I think this has done is created a bit of a cycle whereby failure is caused by having, people arriving from places that have higher levels of COVID at that point of time, but also the commitment to having constant arrivals and constant, unnecessary travel, just holidays, means that the government has an excuse to not get to zero COVID. There was an opportunity, and there was an opportunity in the summer where I think Britain and many European countries actually could have adopted zero COVID strategies. We had such low levels of COVID that it probably would have been possible to stamp it out, with a month-long, really intensive campaign. But all of the governments of Europe and North America said, well, there wouldn't be any point in doing that because then it would just come in from somewhere else, which is a strange back-to-front logic, because what Australia, New Zealand, and the East Asian countries have said is, no, well, obviously, if we had free travel over the summer, that would just bring back COVID. So we're going to stop that travel, and then we're going to stamp out COVID. And a country like Australia, which did have a bit of a first wave, not as bad as ours, managed to go from a sort of terrible herd immunity strategy, which is what we had, to zero COVID. And I think this is going to be one of the key things that is dramatically different next time we have a pandemic, because I feel like governments across Europe and North America have completely misjudged this, and they have misjudged this also across the political spectrum. It's almost a bit of a puzzle. I mean, is that your understanding of this, Aaron, or do you think there is something that's unique to Britain here?
It's an interesting question. I do think that there's been a general, I mean, this is the piece I wrote for Novara Media. It's up on novaramedia.com. You were very kind to tweet it yesterday evening, Michael. Say some very complimentary words about it. We need to be honest. The failure is not entirely Britain or America. The big five countries in Europe, Britain, France, Spain, Italy, Germany, I think between them have around 300,000 casualties. Their population is above 200 million. But comparatively, it's worse in terms of the death rate than the United States. These countries have all seen a recession, which is far worse than the United States. So the failure is across the board in the OECD and the Western countries. A few glimmers of something better. Germany is the best example, but still, and you said this previously, Michael, there are three tiers for the league table of how countries have responded to this. There's the terrible tier, which tends actually to be high GDP countries in Europe and North America. There's the kind of interim tier, which includes Germany, Norway, and then there's the East Asians, and there's Australasia, New Zealand, and Australia. And what's most remarkable, actually, is that there is really no correlation between high GDP and actually effectively dealing with COVID-19. If you look at Vietnam, for instance, it's a very poor country, almost 100 million people, a 1,300-kilometer land border with China, and a GDP per capita about 1/3 that of Bulgaria. So it's far poorer. It's about half as poor as any country in Europe. And yet they've had 35 deaths. And yet they've seen GDP growth this year or last year, 2020. Very, very few countries did that. Even in East Asia, only China and Vietnam managed to accomplish that. So clearly it wasn't about a trade-off between economic growth and low fatalities. Vietnam did that. Clearly, you didn't have to spend billions and billions and billions. We spent £22 billion on the test and trace system, which doesn't work. You didn't have to do that. What did Vietnam do? I think they did three things which were incredibly effective, none of which we have done. The first is they had a very quick responsive border regime in regards to COVID-19. So, for instance, there was the early testing. They closed the border with China very early on. They later closed the border to Schengen countries, Britain, Ireland, and they later, I think March 22nd, before the end of March, stopped all people coming in. When they re-established open borders, people then necessarily were going into quarantine centres. Not like here, self-isolation, where you're not even paid to do it. So, of course, compliance is quite low. People had to go to publicly overseen, nationally administered quarantine centres. And I've seen some people say, that's just the first part. I'll come to the other two parts in a second. When I said this on Twitter, people say, that's so authoritarian. Oh, my God. Well, we have nationally administered schools and universities and hospitals and prisons. If this is a public health emergency, if this, I think, is actually better understood as a national security risk, I think it's an entirely legitimate and reasonable way to carry on. That's the first part. Secondly, was their test and trace system. So unlike us, they actually have a test and trace system which works. There's a great article in The Guardian about somebody who worked in a tower block in Vietnam, and there was one person in the floor above them. The entire building was fumigated. You had third level contact tracing. So contacts of contacts of contacts sometimes have to go into quarantine. Depends how advanced the spread is, in a local area. So very, very extensive. Between the end of January, I believe May, 200,000 people were going into these publicly administered quarantine centres. Now that's a huge number of people. But when you think about it, that's what, 1/5 of a million. And of course, you've got almost 100 million. So it's a tiny percentage of the country, tiny percent, not even 1% of the country. It's 0.2% of the country. If somebody wants to correct me in the comments, they can. And what that has meant is that the rest of the country, broadly speaking, can get on with life. They've had very few deaths, and it's been a real success story. So I think those are two things immediately we should imitate for the next time. The border regime being so responsive, test and trace, and of course, these publicly administered centres. And then thirdly, they were very honest with the public. And of course, it's easy to do that in a one-party state. I'm not saying everything about Vietnam is great, but it's very easy to communicate. Now, my worry with Labour and the Tories, it's this big talking point amongst centrists. We need clear communications from the government. Yes, we do. And that's absolutely something which Vietnam did very well. It's why it was effective. But that was only one tiny part of why they've been so successful. And my worry, and this is where I think Britain is unique, is that whereas the EU, the Nordics, various other countries, maybe Russia, whereas I think they will learn the lessons of this epidemic, just as the East Asians and Australasia did after SARS in 2003, I'm worried purely because of the tone of the political conversation in response to this, particularly from the press, particularly from the Conservative Party, that we won't. And that's the thing that concerns me the most. Yes, it's this particular pandemic. It's terrible. 2021 might be a write-off. We may see many, many more people die, but almost as bad is the fact that I think our political class and the sort of political culture which drives them won't learn the lessons.
I think that's really important. I in a way, I'm quite looking forward to that period where we do assess what went wrong and prepare for what we can change in the future, because there's so much of sort of covering this pandemic is so exasperating because the government seem to be doing, just everything wrong, everything late, even the obvious things they don't do in time. But there are also, and this is interesting on an intellectual level, there are ways in which so many governments have failed in the same way. And so I think reassessing how we deal with the next pandemic is going to be interesting. I want to talk now about one issue which is going to be, I think, crucial in the coming weeks and months in Britain. And this relates very much to what Chris Whitty was saying in that clip we showed you at the top of the show. He was saying that restrictions will be loosened as more and more people are vaccinated, and as we get to a point where the level of deaths we'll have from COVID-19 are acceptable, given the costs of avoiding them. So basically, as I mentioned before, that they hope that if we vaccinate 13 million people by mid-February, then that could, if we reduce restrictions or lower the restrictions, still reduce the death rate by 88%, because the people who are of a profile who are likely to die from COVID-19 are from that 13 million subset of the population. Now, what Chris Whitty was saying there, though, is that once we've got those 13 million done, maybe at that point, we'll say there's still COVID, there's still lots of it around, right? Because only 13% only 13 million people in the population are immune. There's still going to be loads of COVID circulating, but maybe at that period of time, we decide that it's worth reopening certain things. And the example he gave there was schools. And as we said on this show, before, I think it's right to prioritize schools, even if it's not necessarily a good idea to rush into reopening them. But this is where the issue of who gets the vaccine first comes in. Because at the moment, how they have sort of decided who gets the vaccine first is who is most likely to die. How do you reduce the net amount of deaths as quickly as possible? Very reasonable. It means they've come to the judgment that in this first top priority group to hopefully be vaccinated by mid-February, we'll have all elderly care home residents and their carers being vaccinated, not because they're more likely to get COVID, but because they're more likely to give it to the elderly residents who are likely to die from it, and over 70s and frontline health workers for the same reason. Again, they're very likely to be the people who give COVID to people who are going to die from it, and clinically extremely vulnerable people. But there is a debate going on at the moment as to whether, as well as vaccinating people who are most at risk of death, we should also vaccinate people who, when we decide to start reopening various parts of society, are the people who are going to still be forced to put themselves at the most risk. And this is where teachers come in. There is a demand from the teaching unions, which I think is perfectly reasonable, to say that teachers should have priority vaccination if they are putting themselves at a greater risk than other members of society. And whatever Boris Johnson and Matt Hancock tell you, they are. Now, this is one of the things that I think has been the most shocking, immoral, dishonest behavior by our political class, Boris Johnson and Matt Hancock, is to say that teachers are at no greater risk than anyone else in society, which is an outright lie. When they were saying that on TV, they were basing it on data from September up to the middle of October. So that was dates when there wasn't really a pandemic or an epidemic, in schools. If you look at later data, and this only came out yesterday, this data, to my mind, has been suppressed because the government have known about it and they haven't told us. The unions got data off local authorities that showed that actually teachers are, in some cases, 4 times more likely than the rest of the population to get COVID-19. That was secondary school teachers in a certain part of the country. I think on average, they said teachers are 333% more likely to get COVID than anyone else in the rest of the population. That's obvious. I think teachers have known that for a while, but the government have been outright denying it, I think, incredibly dishonestly. And this is why I think finally, I think the government are going to start to feel slightly embarrassed about all of this. They are moving towards a position of giving teachers priority vaccines. Now, this is a story from the Huffington Post, which describes Jenny Harries, who's the Deputy Chief Medical Officer, suggesting to MPs that, in fact, teachers might get the vaccine as soon as the top 4 priority groups are vaccinated. So that would potentially be from mid-February. We can go to a quote from that article. So the HuffPo write, the decision rests with the Joint Committee. So this is the decision of who to vaccinate first. The decision rests with the Joint Committee on Vaccination and Immunisation, the JCVI, which has already published the 9 priority groups for the first phase of the vaccine rollout. Last month, JCVI Chair Wai-Shin Lim suggested key workers would need to wait until all 9 of those groups have been vaccinated until they receive their jab in the second phase. But according to one MP on the call, Harry said, when the first 4 groups are completed, then frontline key workers would be vaccinated, and this would include consideration of teachers. Now, I want to bring you in here, Aaron, because again, I think this is one of those issues where we could see very quickly what was a consensus, what was a position which the government said they were not going to compromise on. We've done our list of nine groups. We're not going to err from it. I think we might see, a real snowball effect where we get a lot of momentum to say, no, actually, unless we're going to keep schools closed until COVID is, only among 20% of the population, then we can't ask teachers to take a bigger risk than everyone else. So we have to accept that if we're asking people to put themselves in more harm's way, we have to also give them more protection. I mean, what do you think? Do you think that's the way that the wind is blowing in this case?
I mean, surely, over the last week, the real opposition in this country has been the NEU. And you're going to have to give them concessions, surely. It's not been the Labour Party. It's not been any elements which are critical, which has happened, right, with the Dominic Cummings affair, for instance. It's not been coming from the media. It's been coming from the NEU. So I think they will have to make a concession, yeah. And I think that's a very reasonable one. I think it will also, it's not a vote loser. There's been this decision to effectively split the doses, which means we can immunize hypothetically twice as many people because we're giving people 1 dose, waiting 3 months, then giving them the second one, which, by the way, could save huge numbers of lives. I don't know the science around it. It's been advocated by, it's important to say, scientific bodies. It's not just a party political push by the government. And it's also being looked at by other countries too. So given they've made that change, and we're going to work with the one dose measure, at least initially, to try and give as much coverage as possible before the end of spring, I think it's a fair thing, isn't it? I think presumably that would be a demand of the NEU, but then the NEU is in a bit of a bind because, of course, goodwill to any sort of labour dispute also is always required from the public more generally. And of course, if they say in a quite sort of they look like a limited interest group if they say we will open if you give us the vaccine. Other people will say, well, I'm a bus driver, I don't get the vaccine, or I'm a taxi driver, I don't get the vaccine. So I think it'll be tough for them to make that a sort of a big political demand. But yeah, either you vaccinate them or I don't think the schools reopen. I think that's ultimately what it's going to boil down to, for sure.
Which is probably why the government will fold, and why I think they should fold in this case. I mean, you're absolutely right. I mean, I think bus drivers probably potentially also should get priority. I think the issue here, because there are two ways of doing this. So the Indonesians have gone for a way of saying, let's actually vaccinate the working age population first so we can get herd immunity as quickly as possible. I actually prefer our way of doing it to that, because I think the way of let's limit as many deaths as soon as we can makes sense. But also I think the issue of fairness has to come into it. And I think here the issue is that even though a 65-year-old retiree might be under more risk of dying from COVID than a 50-year-old teacher, if they catch it, the 65-year-old retiree gets to decide how much risk they encounter. They get to decide whether or not they stay at home or go and hang out in busy shopping centres. The teacher, if they are told they have to go back into school, they don't get to decide how much risk they're putting themselves in front of. Neither does the bus driver, actually. So I do think that after this first wave of 13 million people are vaccinated, the government is going to have to consider the fact that if they want to reopen different parts of society or keep open parts of society that have been open the whole time, buses, for example, they are going to have a quid pro quo where they say, if we're asking you to go out on the front line and put yourself in harm's way, we're going to have to give you the necessary protection. I think there's going to be a bit of a sea change on that one to come. A prediction there. Let's go to Georgia. Unless you have anything you desperately want to add on the discussion of COVID predictions.
No, I think the one thing I would say is that trade unions are bound effectively to ensure the welfare and the safety of their members. And of course, if one particular part of the labour market, in this case teachers, were given vaccines, then I do think that would create something of an issue. Other trade unions, ASLEF, RMT, whatever, unite with bus drivers, that then may become a problem, because there is a limited supply. That hopefully will change, but there is a limited supply. So there could be a dynamic there that's interesting.
We have got 2,300 people watching, only 400 likes. Hit that like button, helps us on the algorithm, doesn't cost you anything. And if you don't want to like us already, you're going to want to like us in 15 minutes time, because we're about to go to Georgia, where we're going to discuss Georgia and speak to Bhaskar Sunkara, who's not in Georgia, but who is, I presume, in New York. I'll ask him in one moment. Democrats won both of Georgia's Senate seats in Tuesday's incredibly high-stakes special election. The wins, the first time the party has won Senate seats in the state in 2 decades, mean the Democrats now control both houses of Congress, massively increasing the room for maneuver of President-elect Joe Biden. The senators-elect are 33-year-old Jon Ossoff, a journalist who beat David Perdue, and the Reverend Raphael Warnock, who defeated Kelly Loeffler. Warnock's victory makes him the first Black Democrat to be elected to the Senate in a southern state. The symbolism of the moment was summed up powerfully in Warnock's acceptance address.
Before you tonight as a proud American and as a son of Georgia. My roots are planted deeply in Georgia soil. A child who grew up in the Caton Homes housing projects of Savannah, Georgia. Number 11 out of 12 children. A proud graduate of Morehouse College and the pastor of Ebenezer Baptist Church, the spiritual home of Martin Luther King Jr. and Congressman John Lewis. A son of my late father, who was a pastor, a veteran, and a small businessman. And my mother, who as a teenager growing up in Waycross, Georgia, used to pick somebody else's cotton. But the other day, because this is America, the 82-year-old hands that used to pick somebody else's cotton went to the polls and picked her youngest son to be a United States senator.
So you can tell there, I mean, American politicians just seem to have a bit of a more impressive way of speaking than Labour MPs. Jon Ossoff also proved himself to be an impressive campaigner, including when giving interviews to the hostile Fox News.
Right now, we have a crisis of corruption in American politics. And since we're live on Fox, let me take this opportunity to address directly the Fox audience. We have 2 United States senators in Georgia who have blatantly used their offices to enrich themselves. This is beyond partisanship. And the reason, to your question, that I talk so much about health and jobs and justice for all the people is that we can unite behind that program. We've lost 9 rural hospitals in Georgia in 10 years. We can reopen them. We can invest in infrastructure to build jobs, revitalize our communities, create opportunity, raise the minimum wage so that people doing an honest week's work can not just survive, but can thrive. And yes, pass landmark civil rights and voting rights legislation to secure equal justice for all. And I humbly and respectfully request the support of everyone who is tuned in on Fox right now. And I'd love for you to log on to electjon, electjon.com. That's electjon.com. Make a contribution to our efforts here in Georgia.
Very good. So John McDonnell style, to camera. He knows he's got a hostile interviewer, so he speaks directly to the audience. And it gets actually more impressive because Jon Ossoff would not be pushed off track by what were intended to be awkward questions about his running mate.
Any concern that the allegations of wrongdoing against Reverend Warnock could possibly be a drag on the Democratic ticket next week?
None whatsoever. Reverend Warnock addressed this issue a year ago. And here's the bottom line. Kelly Loeffler has been campaigning with a Klansman. Kelly Loeffler has been campaigning with a Klansman. And so she is stooping to these vicious personal attacks to distract from the fact that she's been campaigning with a former member of the Ku Klux Klan. I mean, we deserve better than that here in Georgia. And I want to encourage everybody to make a plan to vote on Tuesday.
So to discuss Ossoff and Warnock's win and what they mean for Joe Biden's presidency, I'm delighted to be joined by Jacobin editor and friend of the show, Bhaskar Sunkara. Bhaskar, thank you so much for joining us this evening.
My internet connection has been awful for the last 5 minutes, and I spent about 5 hours yesterday watching The Sopranos, and my internet was fine, but somehow when it comes to talking about politics, my connection is failing me, so hopefully it lasts through the interview.
It might just be that your download speed is faster than your upload speed, instead of sort of the CIA intervening to try and stop you, talking about progressive American politics.
I download torrents. I seed them to the people. So my upload speeds are fine. It's the CIA. I'm very confident of it.
I want to start by, with the basics. Democrats haven't won a Senate seat in Georgia for 20 years. Does that make, is this a genuinely impressive win here?
Yes, of course. It's definitely impressive. I think it's a reflection of the minoritarian base of Trump. It's a reflection of demographic changes in Georgia, which is, I think, going to be a blue state for a long time. Right now, we're at the point where we consider Virginia and Colorado pretty safe, blue safe states, but up until a couple election cycles ago, these were Republican strongholds. I think the Republicans have a really built-in disadvantage in certain states at the electoral college level, which is going to make it easier for Democrats to squeak by with certain presidential wins in the future. And I think now Georgia is much safer. Then obviously there's been some great efforts in organizing, which have come from the grassroots. I think the candidates both the candidates are flawed, but especially Ossoff is a centrist Democrat. But a lot of community groups, a lot of labor groups, a lot of left wingers were involved in efforts to turn out and mobilize votes. There's been previously efforts to fight against voter disenfranchisement. It's quite easy for Republicans to target which districts should have a harder time to vote and what's not, because a lot of the Democratic voting bloc is black and brown and are in those those communities and those neighborhoods. But there's been efforts to fight that, and I think they've all come to fruition. And this was very, very astounding victory. But I think it took both organizing and these underlying trends and changes in some of these states in the South that I think are going to be, at the very least, battlegrounds in the future.
And can you talk a bit about the nature of the campaign? So, I mean, we showed there a clip of John Ossoff trying to be, getting attacked on the basis of Warnock's history. He responds saying Kelly Loeffler's been campaigning with someone from the KKK. Can you talk about the nature of this campaign? Was it a particularly dirty battle?
Not necessarily, just because U.S. politics has just become that. I mean, this is politics in the U.S. Is at the point where it's just hyper partisan and hyper polarized, to the point that it becomes a game about mobilizing and turning out your base. And this has led to a lot of these things. And I guess I should say that by the context of world politics, U.S. politics is not particularly polarized. But we have this system which has so many different choke points and so many different places where the system could break down. It becomes very difficult for the U.S. to govern itself with this kind of presidential system with all its choke points. And it's definitely reached every level of politics. Obviously, in the case of the Georgia race, there is this extra layer of very racialized attacks on Warnock, kind of accusations that he was some sort of closeted, far right or left or both, black nationalist, which obviously isn't the case. Ossoff himself is a very moderate centrist Democrat too, but obviously there was attempts to corner him around certain appeals that Republicans thought would be successful, defunding the police and so on, certain of the things pushed by the left wing of the party that aren't yet that popular on the voting bloc, writ large. But obviously it didn't work, in part because people weren't really voting for either candidate. They were voting either for or against Donald Trump. And I think this is really a referendum on Trump. And the fact that he hasn't been able to take his minoritarian right-wing populist base that got him elected and make it a broader majoritarian base, which is a good thing. Though who knows? I think the trends would indicate that the next Donald Trump might be able to do just that.
And what does this mean for Joe Biden's presidency? So, I mean, the immediate analysis after that election was that this was a bit more disappointing than people were expecting. People thought the Democrats hadn't won back the Senate, so assumed it would be a really weak presidency. Now the Democrats have the presidency, the White House, the Senate, and the House of Representatives. Does this mean that, well, I mean, we can discuss how much Joe Biden wants a transformative campaign, but does it put him in the position to put forward, a fairly ambitious legislative agenda?
Well, to begin with, I think that Biden's performance was actually pretty impressive at his own level. If you consider how many million votes he won over Donald Trump, I think the final count was around 4.5 million more votes. There's a lot of states where he's been very he was competitive in. You could see him making some gains again in the upper Midwest, kind of winning back some of these old Democratic Party bastions. But on the whole, obviously down ballot, it was more of a success for Republicans than they would have than people anticipated. I think the Georgia race is consequential in the key way that it allows the Democrats to be the ones putting forward bills in the Senate. So combined with the bully pulpit of being able to introduce legislation, plus having the bully pulpit of the presidency, that will allow Democrats to set a lot of the agenda. It makes a big difference for court appointments, particularly federal court appointments. It's not just the Supreme Court, it's a whole network of federal courts in which Trump probably left his biggest lasting legacy were in these court appointments. Certain things can be passed by budget reconciliation. So essentially in the Senate, in order to get anything done, you need a supermajority of 3/5. And as a workaround to prevent this from just totally crippling U.S. Governance, there's this ability to pass certain key legislation or key measures, I should say, in budget reconciliation. So short of it is, I think it does give the Democrats some more leverage. It means that they have to maintain every single member of that Democratic body on board. And there's two representatives in particular, a senator from Arizona, a senator from West Virginia, that are quite moderate in the U.S. context, but really, would find a nice home in any center-right party around the world. And I think that does limit what can be done, but we really need to say on the left that we won't accept or tolerate any excuses from the Democrats. There's a lot that Joe Biden can get done through executive order. There's a lot that can be pushed through, even with this very slimmest of majorities.
I want to talk about now a story which has been developing since we went live. So I haven't double-checked you're across it, but it seems like there are a bunch of people in Washington, D.C. currently trying to mount a coup. So we are going to see some images now of Trump voters who have successfully, I think, broken into Congress. So this is well, there's I hadn't realized it was that many people. So this is apparently people currently protesting outside Congress. And I think in a moment we're going to be able to see some people breaking into Congress, which is surprising. I'd have thought they would have had better security. And I think we can get up an image of people now in the chamber. Okay, so this is people walking around Congress with their MAGA hats on. The security seems to be fairly soft. I don't know if they were Black Lives Matter protesters, they would have been let in quite so easily or faced. I mean, it seems like not much resistance at all. And I think now, can we see an image of one of them in the chamber? So they are sitting in, my knowledge of American politics is not quite good enough to know what chair this is, who would normally sit there, but they're in the chamber saying Trump won that election. Bhaskar, this is very much a developing story. Were you aware that there are a bunch of kind of cranky people trying to mount a coup in Washington, D.C.?
I was aware. Actually, I left my sound on because my headphones died. So I think you might have heard people texting me to that effect when I was on. It's scary to see a Confederate flag in the Capitol. I think the long dream of like 1862 is finally upon us. Yeah, I mean, I think that obviously there's a base of Trumpism that's very riled up, that isn't giving up power without a fight. And they're going to continue to dominate the Republican Party for years and perhaps decades to come. And that's one reason why all these Republican politicians even are very careful and want to cater to this base and don't want to concede the election loss. Ted Cruz is not at a loss about what happened. Ted Cruz knows very well that Donald Trump lost the election, but he also knows that he has a base of supporters that will soon oust him if he doesn't go along with this and if he isn't shown as putting up a fight against this. I kind of wish maybe you all on the Corbynite left in the UK was able to mount such a rearguard action in the past year, but these people are not going to give up, and they're going to be around. I think that we should probably, differentiate between the manifestations of far-right violence in the streets and a protest. Obviously, I'm not sure if they're armed, what exactly that situation is like. But obviously, on the left, we stormed the Capitol for good cause in Wisconsin. So I definitely do think that if it was a left-wing protest, if it was a BLM protest, it would be met with a lot more violence, a lot more repression. But I certainly hope that one day soon we could be the ones storming the U.S. Capitol, just like we did the Wisconsin Capitol in 2012.
Do you think? This is going to be my final question to you, actually, which is that. And again, I suppose this could link back into you saying we want the Justice Dems to be doing this next time around. I mean, my question was going to be, do you think the Republican Party is kind of eating itself now? Because there does seem to be this real big split between the Trump hardcore who want to pretend that Trump won the election and are storming Capitol Hill with MAGA hats. Apparently, I'm informed that the mayor of DC has now ordered a curfew. Like, I don't know how well this is going to go down with the American electorate. Do you think that, are things looking pretty bad for the Republican Party going forward, or do you expect that in 2 years' time they can probably just win the Senate back, and we are going to have, this sort of breach within the Republican Party is kind of temporary, and there is going to be a Republican Party which is just as successful in 2 years' time as it was in 2016 under Donald Trump, or under Donald Trump's presidential.
This is going to sound very, very nihilistic, but I think nothing matters anymore. It just, I think to one extent, American politics is so polarized. You could literally run me as the Democratic Party candidate for president, and I would definitely lose, but I would get 45%. You could run David Duke or any far right extremist and get 45% of the vote. American politics is that polarized. What I'm very worried about is that, in fact, the Democratic Party's coalition is far weaker than it would appear. So it's weaker at two levels. One is it's increasingly becoming a wealthier and more highly educated coalition that's geographically cloistered, disproportionately in suburbs and other geographic areas. So in part, the geographical factor actually matters more than anything else, because it has a lot of ramifications given the U.S., the structure of our political system. I guess would be, the same thing in parliamentary systems, where depending on how the boundaries are drawn. I think that really does have consequence for the Democrats. In the last election in November, Trump's base actually did get more working class. In particular, he did win over more Black and Latino voters. Voter turnout was up across the board, but it was lowest. The increase was lowest in Black working class areas. So it won't be defections to the Republican Party necessarily, but it will be people not turning out, not believing politics can make a difference in their lives. You're seeing the same underlying patterns of class de-alignment that you've seen in center-left parties across Europe, only accelerating in the US. And I think the Biden victory and developments in Georgia, which are very promising, might mask these underlying national trends. So what would it take that if you had a Donald Trump figure who actually delivered the goods on some big economically populist programs, a big jobs program, disproportionately targeting Black and Latino areas? You could take your 48% coalition that was almost enough to maintain power and turn it into a 51% coalition with the geographic and other advantages of the Republican base that gives them more power in the Senate and other bodies in the US. And you could actually govern. Trump could actually have had a majority to govern. So I think overall, I'm very worried about the next 4 to 8 years of American politics. We've talked for years, that I was perhaps too optimistic about the Bernie Corbyn moment. So I'm actually prone to optimism, but I am more worried in the past year than I have been about the future of American politics. And I'm afraid that this might just be a reprieve from a broader shift towards a resurgent right populism in the future, unless the Democrats figure out a way to fight class de-alignment and to restore something of a working class base once again.
Something to hope for, but potentially not expect. We'll be looking out for it. And obviously, all of our audience, if you want analysis of whether or not the Democrats are realigning their traditional class base, there's only one place to go. Jacobin, is it .com?
Yes, .com.
Jacobin.com. Bhaskar Sunkara, thank you so much for joining us this evening.
Thanks for having me. Take care.
We are going to go on to our final story. First of all, if you're enjoying the show, you know what to do. Hit that subscribe button. We go live every Monday, Wednesday, and Friday at 7 p.m. And also, if there's a surprise big news story that we feel you just have to know about. Our final story for the evening. A new 24-hour rolling news station is launching in the UK later this year. It's called GB News and looks like it will try to ape the success of Murdoch's Fox News in the United States. The project isn't being funded by Rupert Murdoch, however. The major investment partner was US-based network Discovery Inc., who already have a documentary partnership with the BBC in the UK. They reportedly invested around £20 million. It's now reported that GB News has received £60 million in funding. Now, the rest has come from Dubai-based investment group, Legatum, and one of the UK's most prominent hedge fund managers, Sir Paul Marshall. We're talking big money here. Now, if you're unfamiliar with these characters, Press Gazette had these details in their write-up of the story. So they write, Legatum is known for its funding of think tank the Legatum Institute, which launched in 2007 and became a vocal advocate for Brexit during the 2016 referendum. It also produces the closely followed annual Prosperity Index alongside investment and research divisions. Sir Paul is the co-founder of hedge fund Marshall Wace and was a donor to the Vote Leave campaign. His stake in GB News will be in a personal capacity, the company added. The businessman is also co-founder and chairman of ARC Schools, a multi-academy trust of 38 schools and funded political website. Oh, Unheard. I didn't know that. GB News will be hiring 120 journalists plus 20 more support staff, and the project will be chaired by former BBC presenter and Spectator chairman Andrew Neil. Andrew Neil will also host a primetime show on the channel. Now, of the project, Andrew Neil has said, "We're thrilled to have such a broad range of high-caliber investors who share our belief that many British people are crying out for a news service that is more diverse and more representative of their values and concerns. GB News is a massive undertaking in a fiercely competitive market, but we're confident there's an appetite for a fresh approach to news in Britain, Northern Ireland, and the Republic of Ireland." Now, actually, we're going to go to some BBC News in a moment. First of all, Aaron, I want your take on this enormous sum of money that a TV station that doesn't yet exist has managed to raise. £60 million. This is a serious operation. 120 journalists.
It's terrifying. GB News is going to have 140 members of staff, 120 journalists, for a kind of baseline figure. Unheard, which is, as you've said, is funded by one of the gentlemen behind this now, to the tune of millions of pounds. Unheard, initially the pitch was 6 to 12 journalists. So we're looking at a really, really big outlet. It's probably going to be on DAB. It's definitely going to be on television. You'll be able to watch it with 3 of you and so on. And of course, 60 million, a huge amount of money. But I have to say one thing, this is not unique. You've got GB News with Andrew Neil, but you've also got, of course, News UK TV with Rupert Murdoch. They are building the studio as we speak. There's something of a race between News UK TV and GB News. Of course, we've had the launch of Times Radio last year. So you look at Talk Radio, Murdoch. You look at Times Radio, Murdoch. You look at News UK TV, Murdoch. You look at Sky News, no longer News UK, but that's kind of the world it's coming out of. When are we going to start talking about anti-competition law? You look at Global, which has Classic FM, Capital, Heart, LBC. This is a company which funneled £200 million through tax havens in the 5 years to 2013. We have a major problem in terms of the media in this country, and it's about to get a whole lot worse. A whole lot worse. All the right-wing outlets are really innovating, right? So, like I said, the Times, you've got Sunday Times is now becoming a really prestigious, again, I think, high-quality Sunday paper, investigative reporting, and so on, setting the agenda. On the other side of that, in terms of Murdoch's offer, you've got Talk Radio, you've got Times Radio. And I think this is really worrying. You look at the very few legacy, progressive, left-wing outlets which we have in this country. There's The Guardian, questionable. I mean, it's liberal, it's not left-wing, but let's just, even that's quite rare. So let's hold that for a moment. There's The Observer, and there's the Daily Mirror. These are the 3 newspapers which right now are innovating the least. The Guardian was doing great work 10 years ago, leading the way. It's kind of lost that advantage. The Observer is dying, frankly, which is a great shame because it's been around since the late 1700s. And the Daily Mirror, I think, will be the first national daily paper to stop. Of the ones that remain, of course, the Independent went a few years ago. So we have big problems. If people think that the media environment in this country was bad in 2016, in 2017, in 2019, wait till 2024. which is why we need to support and fund alternatives. And that's important. And I'm not just saying about go to novaramedia.com/support. I'm not doing your job, Michael. That.
Well, don't do that.
I'm not going to steal your lines, your best lines.
Okay, yeah.
But we clearly need a sustained effort now from the labour movement, social movements, high net worth individuals to back projects. Clearly, right? Look at the voter registration, the deep organising in Georgia, which is how the Democrats won. Look at the media efforts from the right. We're not doing any of the things that are effective by the right in this country. We're not doing any of the things that are effective with the left or the centre in the United States. We're in a really bad way if we don't sort this out. I mean, Novara Media right now, with a few other outlets, is the exception. And I have the fullest confidence we'll be huge by 2024. Of course. But my God, we are looking at a lot of operations coming up against the left at the next general election.
And I don't think any of our audience will be surprised to know that Novara didn't start with £60 million seed funding. So we've had to grow much more slowly than you get to do if you are advocating for the interests of billionaires. But we're delighted at the amount that we have been able to grow, especially over the past year because of all your kind support. If you want to make sure there are left media projects to try and outcompete GB News and these, they're trying to shift the media further to the right than it already is. A disaster. Then do go to novaramedia.com/support. One other thing we should add, the BBC probably isn't going to save you. So these outlets, I think one of their big aims, politically at least, is to put pressure on the BBC to try and shift to the right. I think people on all sides of politics in this country recognize how much influence the BBC has over political opinion in this country. And I suppose there's been some bad news if you don't want the BBC to be a linchpin of the right in this country. That's because the corporation has unveiled their new chair. He is this guy. I think we can get an image of him up. It is Richard Sharp, who is a former Goldman Sachs banker. Now, whilst Richard Sharp was there, he was the boss of the current Chancellor of the Exchequer, Rishi Sunak. He's also spent the past year as an unpaid advisor to Sunak on the economic response to the pandemic, something he's expected to give up to do this new role, not doing a George Osborne where he manages the Evening Standard and has all of these advisory jobs on the side. According to the Electoral Commission records, Sharp has donated more than £400,000 to the Conservative Party since 2001. And since 2002, he's been a director for the Centre for Policy Studies, a right-wing think tank. Now, this appointment follows the appointment in September of the new BBC Director General, who is Tim Davie. Now, during the 1990s, Davie stood as a councillor for the Conservative Party and was deputy chair of the Hammersmith and Fulham Conservatives. So we've got this organiser. You've got Andrew Neil saying the BBC is far too left-wing. That's why we need this new 60 million organisation to drag it in the other direction. Julia Hartley-Brewer railing against the Liberals at the BBC. And then in charge of that organisation, we now have as its chair someone who has donated £400,000 to the Conservative Party, and as its Director General, someone who's literally stood as a Conservative Party candidate. Aaron, it doesn't seem like the BBC is going to be a particularly strong line of defence against this attempt to sort of foxify the British media environment.
Yeah, we were talking about this today, in fact, weren't we? And there is an argument to say, well, perhaps it's good that the kind of GB News and News UK TV would act as a kind of leech to suck out the kind of right-wing takes and the ideas, and that's where the Tory politicians would go for interviews and so on, and the BBC could be more centrist. I think that's a compelling argument, but it's clearly not going to happen when you see the people involved. I don't know if you mentioned this a moment ago, but Richard Sharp, as well as giving £400,000 to the Conservative Party, which, by the way, some of that money was as recently as December 2019. He's on the board of the Centre for Policy Studies, which is as right-wing as a think tank you will find in this country. And by the way, the wife of Lord Rothermere, who owns the largest media group in this country, who's also a tax dodger and lives in France, is also on the board of the Centre for Policy Studies. You've got about 1,000 people in this country who really do control a lot. We don't need to create conspiracy theories around the Illuminati and whatnot. It's just about very affluent people trying to protect and expand their influence in politics through ownership of the media so that they become even richer still. Not that tough to understand. We don't need to lunge for COVID conspiracies and pandemics when we can talk about capitalism.
Although saying that, I'm not saying, actually, maybe we should talk about COVID conspiracy and pandemics. I do think there is a relevance of this story about GB News and COVID conspiracies, because what we've been talking about, or what seems to have been accepted right now in the mainstream media, is that the COVID deniers were wrong. You know, Toby Young was wrong. Carl Hennigan was wrong. These people who said maybe we had herd immunity in summer, maybe the pandemic was already over, maybe lockdowns do more harm than good. They were wrong. The Julia Hartley-Brewers of this world, they were wrong.
Hey, Robert Peston.
These are the people. These are exactly the people. Yeah, well, Robert Peston was more of he just sort of passively reports, you know, whereas it was Toby Young and Julia Hartley-Brewer actively pushing that this is all because of false positives, whereas Robert Peston is this more sort of like, maybe it is because of false positives. Maybe herd immunity will say, you know, it switches every half an hour. But what these channels are going to do is precisely empower all of the people who were, you know, pushing the most disastrous responses to this pandemic, and probably do have, I don't really think this is an exaggeration here, blood on their hands, because we know that Boris Johnson has been very, very responsive to these people. It's reported in the FT that he has been, throughout this pandemic, very, very unwilling to upset people on his backbenches. Where do the people on his backbenches get their news? From The Spectator, from Talk Radio, from The Telegraph, from all of these outlets which have been saying, oh, maybe we've already got herd immunity, lockdowns are a disaster. They're the people who have been, you know, very, very influential when it comes to what policies Boris Johnson has adopted. Because again, he's a bit Peston-like, a bit of a sponge, sort of like, I want those people to like me and respect me, so I'm going to adopt their particular policy platform, even if the evidence, you know, behind it is terrible. And we're currently facing the consequences of that. So if you think that Britain's media environment as it currently exists has not helped us in damage limitation when it comes to this pandemic, imagine when you've got a mainstream TV channel run by Rupert Murdoch, News UK TV, and a mainstream news channel which is chaired by the person who is also the chairman of The Spectator magazine, which basically was the house journal of lockdown skepticism. It could have been much worse, and if it happens again in 3 years' time, there's every likelihood it will be if we have someone like Boris Johnson still in power.
I mean, when you see these social media videos by Nigel Farage, and of course we've all seen these when he was going to Dover and, you know, seeing various dinghies landing and so on. You know, he's casting here. He wants to be an anchorman, whether it's at GB News or News UKT. You know, that's clearly where he sees his future. And that's really concerning. You know, we're not that far away from a media environment where Nigel Farage has an evening TV show, you know, where he's competing for ratings with Piers Morgan. He won't win, of course, because ITV's, you know, it's a big outlet. But let's not forget, you know, it took LBC 20 years to get where it is today. And it still, of course, is not a rival to the big players on broadcast TV, but it's something of an agenda setter. You know, and I think it's important for the left to understand this. You know, the right does not think in terms of 6 months, 1 year, 2 years. They think in terms of 10, 20 years. And I think, you know, yes, this will be terrible in 2024. We will see immediate impacts from the creation of these outlets. But also, I just think long-term, it's going to massively corrupt politics and civil society in Britain. I really do. And I say Britain because I think the more mainstream this stuff becomes, the more likely it is that Britain will fragment. Already priced in my estimation anyway. But it's inevitable. If all of a sudden Farage and Andrew Neil and Fraser Nelson become not right-wing voices, but kind of, you know, established voices that more and more people are listening to serendipitously, I think that has so many terrible implications for all of us. We have to do something about it.
Precisely. One thing you can do about it, I mean, there's plenty of things you can do about it, but one thing you can do about it is go to novaramedia.com/support and help us build an alternative. I would like to say, because the billionaires have denied us all the money, but we haven't asked. Again, you probably won't be surprised to know. We are now going to go back to Washington, D.C., because it does seem like this is quite a dramatic developing story. We're going to start by showing you a clip of Donald Trump speaking at the rally, which is looking like a bit of an attempted coup. Let's take a look.
We're going to try and give our Republicans, the weak ones, because the strong ones don't need any of our help, we're going to try and give them the kind of pride and boldness that they need to take back our country. So let's walk down Pennsylvania Avenue. I want to thank you all. God bless you, and God bless America. Thank you all for being here. This is incredible. Thank you very much.
Isn't this, Michael? Isn't this
He
incitement
was
to
going to do
riot?
YMCA again.
Isn't this incitement to riot?
Well, I think probably what happened is he got advised that was incitement. Well, I think he probably got advised that was incitement to riot, which is why he's put up this tweet, which is sort of rolling back on it.
But you can't say "take back our country." Then people enter, the Capitol building, and there are allegedly gunshots. I mean, that's you've catalyzed a chain of events clearly there. Isn't that crazy? That's not even if it was a congressman or a senator, you'd be wow. It's the sitting president of the United States.
And the background here for anyone who's unaware is that there's currently a vote in Congress confirming the decision of the Electoral College to elect Joe Biden. So there's been some pressure from Trump to Republican congressmen to reject the decision of the Electoral College. There are people like Ted Cruz who are on side, but there aren't enough Republicans on side to make this really work, which is why Trump is sort of taking this fairly desperate move to get his hardcore supporters to storm Capitol Hill. They ended up properly storming Capitol Hill, going inside and shooting guns inside the chamber.
Allegedly.
Which, as I've said, is probably why Trump then sent this tweet to try and, I suppose, wash his hands of whatever are the consequences of his prior actions. So he tweets, "I am asking for everyone at the US Capitol to remain peaceful. No violence. Remember, we are the party of law and order. Respect the law and our great men and women in blue. Thank you." And then I think we can also see a tweet from Aaron C. Davis from the Washington Post, who says, "Breaking, a source tells me the Defense Department has just denied a request by DC officials to deploy the National Guard to the US Capitol." I mean, this isn't a coup. I mean, this is more of a pantomime. I mean, America is almost offensive of the actual coups that have been ignored, that have been organized by the CIA and by the American government to call this one. Because when the Americans actually organize a coup and when it actually has the backing of the American establishment, you have hundreds of thousands of people who are brutally killed. That's not going to happen in this case. Republicans aren't willing to do that to their own countrymen, even if they are to people in other countries. So this does seem like
Michael.
Yes.
I agree with you. This isn't a coup, but to what extent, if let's say 20, 30% of Republican voters think this is appropriate behavior, to what extent can you govern a country like that? I mean, that is permanent low level. I mean, it's not civil. We're not going to see a civil war. Famous last words.
Terrorism, right?
That's what I mean. I'm saying, to what extent are you going to see the threshold in terms of political violence? It may become quite different now. It may become a very different world once Joe Biden becomes the president, enters the Oval Office. There'll be a significant minority of American citizens who don't think he's the legitimate president, who think political violence is legitimate, who think political vandalism, destruction of property, etc. is legitimate. I agree, it's not a coup, but I think this has huge long-term implications. This may just be a snapshot of what actually millions of Americans are willing to do, right?
No, I think that's quite possible. And I mean, one thing it does is it makes America look like a fucking joke, right? If you're the Chinese Communist Party and you're trying to convince your population, and they do seem fairly convinced, that you don't want the kind of liberal democracy that the Americans have, you just show them, people shooting in the houses of Congress because they won't accept that Donald Trump, an imbecile, has lost. Let's wrap it up there. Aaron Bastani, it's been a pleasure as always.
My pleasure.
It's a shame we can't coalesce in person. Coalesce, is that the right word? Congregate in person. But
soon.
One day. We also have a super chat from Lucy Hayderman. Oh, it's just disappeared. Maybe it'll come back. Oh, there it is. Can we get a happy birthday shout out to my little bro Ben, who's been in school today working as a TA? Huge thanks to all the key workers and stay homers out there helping us get through this mess. And of course, Novara Media. Happy birthday to Ben. Again, yeah. Thank you to all the TAs out there, because even though the National Union of Education managed to force the government to take the most limited, sensible action you could possibly, the bar is so low. But anyway, the NEU got the government to close schools, which is of benefit to all of us. But TAs are still, teaching assistants are still going into school to give an education to vulnerable kids and kids of key workers. Thank you so much to people who are, have to go out and work on the front line of the pandemic, who don't get to, stream from their bedrooms like I do. I prefer to be in the studio, but I also am, I'm grateful that I don't have to put myself out there and quite possibly catch COVID. So a big thank you to anyone who is on the front line in that way, and happy birthday to Ben. For now, though, Aaron Bassani, it's been a pleasure. I hope you enjoy the week in your house. You've got a dog you get to walk. That's what I'm very jealous of. But one day maybe I'll have one.
It's great.
Yeah,
it's great. It's a game changer. You can't not leave the house. It's very good in these conditions. That's a really useful thing.
A good prop. You have been watching Tysky Sour on Novara Media. Good night.